Hello, my dear students. We are Free Dental Guide on behalf of AI Medical Dental Academy. We will be providing you free guidance, free tips, how we will be passing dental Gpsc, and all the dental Gpsc related queries will be solved. This is a best opportunity for all the dentists because till many years, around 3 to 5 years, people are asking that when will dental Gpsc class 2 surgeon will come. Apart from that, tutor exams also, when they will be coming. So people were having many doubts. Now the issue is what to prepare, when to study if you are a clinician, or what are the myths about dental GPSC. This is just an introductory lecture in which you will be able to ask any queries if you are having any doubts related to dental GPSC. There are many theories of dental GPSC. Previously, people used to tell that it is just setting, those who are having approach will be selected, but it's totally wrong. As far as GPSC concerned, people who will be working hard, who will be having maturity in their content, who will be having good knowledge of dental subject, will be securing good marks. Because when you go through prelim result, you will be seeing that there will be a huge difference between the marks. For example, if a prelim is conducted of 200 questions, you will be seeing that it is a only a good thing to pass or get good marks in prelims. If you get around 150, your chances of securing your seat in dental GPSC is very good. Because if you get a good margin than other candidates in interview also, you will be somewhat ahead of those people, because in interview most of the marks are in the range of 30 to 60. No one is getting above 80 or 90, so it is a range of 35 to 60 as far as I know it. So basically, first of all, for passing dental GPSC, you must be thorough with your content. Now, what is that content? It is a thing, or it is a logic in which if anyone asks you any sort of question from any dental subject, you will be able to answer that conceptually. Now, concept and content. Concept is that, for example, if you are asked any question about muscles of mastication or muscles of facial expression, starting from the branchial arch, you will be able to answer all the questions related to nerve supply, blood supply, their origin, their insertion, their main function, or their elevators, depressors, or which muscle is responsible for smile, which is for crying, etc. All these questions come in your concept. The first thing is you have to go through the content. Now, second thing is you have to go through the concept. If many people, when they contact me or any other seniors or any other past candidates, they just ask one question: dental pulse is enough? So either dental pulse is enough or it is not. Why I'm answering that? Because still your concept and content is not clear, you will not be able to score good in the prelims. Because in prelims nowadays, in this month or in this previous month, many dental GPSC exams were conducted. So in all these exams, what these people are doing, they are going with tough questions. Okay, they are going with tough questions. Now, why these are tough questions for us? Because we generally have a tendency to read only pulse. ओके, पल्स हो गया तो सब कुछ हो गया, हम लोग पास हो जाएंगे. नाउ दिस इज ओनली a basic thing. Okay, now to for creating content, mature content, and your concept, you have to read many things. Which are the things? First is the explanation of any MCQ. Okay, whatever you read, you must be understanding this explanation. Okay, From this explanation, they are asking these questions. It is not that directly from the pulse they will be asking. Okay. Now, apart from pulse, there are many books which you have to read, which you have to go through it, and you have to build up your content and concept. Now the question comes, sir, we are not able to complete pulse, then how will we be able to complete other books? So the same thing I am answering. If you cannot complete pulse, it means you are not having good discipline in your reading. You have to spare some time. Time also is important. For example, 5 hours, 6 hours, and you have to develop your own target. That in this time, I'll be finishing this topic. Okay. So for this purpose, will be our batch, coaching batch, will be starting from 15th February. In this, we'll be giving you a proper timetable. In our coaching batch, we'll be giving you proper timetable. Okay. Unlimited test series will be provided. What is this test series? When you read anything, you have an habit that whether I am clear with this subject or I am knowing this subject or not. So our test series is for this purpose only, that what is your level in that subject. Okay, we are the only academy which will be providing you unlimited test series. What is this unlimited? If you want to give any subject test any number of time and at any time, we will be providing you this service. It's an artificial intelligence. Our name only suggests it's artificial intelligence medical dental academy. Based on your logic, based on your capacity, you have to give test, and based on this result, you will be focused that you are lacking knowledge in these topics. You have to go through this. Our all the mentors also will be focusing on you that you are lacking this concept, these topics. So we will be providing you lectures on those topics. Now, apart from this knowledge or topic which you are remaining to read, we this test series also will be providing you knowledge or your like they will this test series will provide you something knowledge which is extra, which knowledge you are living or attempting skill for any question, whether you are living or attempting, or you are just guessing up, or you have to think that if it is A is the answer, B is the answer, C or D. Now sometimes in GPSC there is also an E option. In all the papers they have right now introduced E option. So if you don't know the question and seniors are telling that sometimes you have to attempt it even if you don't know. So in this case, what you will do is you will, for example, you go for every question, you go for C if you don't know, okay? Or leave it any, you pick it B. Now at the end of our test series, our software will tell you that you have a good skill of attempting wrong questions. If you don't know, even if you attempt, you have a good skill. Why this will happen? For example, in GPSC, for any correct question, you get 1 mark. And for wrong question, minus 0.33 or 1/3 of the mark will be deducted. Okay. So, for example, we conduct a test of 10 questions. Test of 10 questions. Now, for example, any question answer you don't know, and you just go with this guessing skill, okay? Or this is guessing, or our tukkabazi in Hindi. So even if your 3 questions are right, okay, you will get 3 marks for one this, and for remaining 7 divided by 3, it will be around 2 point something 133 or something this. So your score will be greater, you will be 0.67 ahead. Okay, 1 minute, let me adjust this screen. So you will get for 3 questions, you will get 3 marks, and for remaining 7 by 3, 2.33 will be deducted. So still your 0.67 marks you will get of this test, though you don't know. Now in this case, if you don't attempt any, you leave all the 10 questions, so you will get 0 marks. So which is higher, 0.67 or 0? So in this way, our test series will provide you what is your guessing skill, और आप कितने तुक्के लगा सकते हो क्वेश्चन में. 200 क्वेश्चंस की एग्जाम होती है, तो आप कितने क्वेश्चन अटेम्प्ट ऐसे ही कर सकते हो कि आपकी स्किल अगर अच्छी है तो कभी कभार ये भी आपको देखना होगा कि आपकी जो पोटेंशियल है वो आपको ही पता चलेगा. हम लोग क्या करते हैं, बोलते हैं आपको ये करो वो करो, लेकिन आपका पोटेंशियल आपको ही पता होना चाहिए कि आप क्या कर सकते हो क्या नहीं. So to unleash this potential, our test series will provide you best platform. Okay. Now the things are very easy. How to read, what to read, and we'll be providing you proper timetable. In this time, you have to finish this subject. At the end of this subject, we'll be having a group discussion. Also, with this discussion, we will be having interview type. Okay. At the end of 1 week, we are planning to finish one subject, and after 1 week you have to give test in our test series. You will be getting instant result. Okay, for this 1 week test. Apart from this, at any point of time, right now when you join this academy, you can give n number of tests at any time. Okay, this will also boost your potential for exposure to unknown questions or random questions. Or exposure is important because the more you face unknown questions, more you face difficult questions, it will be easier for you in the exam. You will not be unknown to most of the questions. Okay, now after this 1 week is over, we will also be arranging mock interview. For example, our oral surgery subject is over, we will also be going for viva or interview type, when all the participants will be live there, so that everyone will be knowing the skills of others, how they answer, what they will be answering, and notes can be prepared easily. There are many queries also. See, one question is there, mercury spillage is there, so how to manage that. So during my Gpsc interview, Dr. Dinesh Dasa sir had asked me. So I told that, sir, different books have different opinion. Even I am confused how to do that. But I know all the books. According to this book, this is the method. According to another, this is the method. And for the third book, this is the method. So sir was very happy. You are having a good answer. Why? Because nothing is permanent or nothing is specific that Pearl's answer is right according to this. So this answering style will be developing when you attend more and more interviews, and you will be asked many questions from our mentors. Okay, so what I mean is, it is not that when you answer, okay, when you answer any question, you have to always give its base. Okay, now for example, if I tell you what is PDL width, कमेंट करके बताइए PDL width कितनी होती है. अभी जो भी लोग लेक्चर देख रहे हैं उनको कमेंट तो करना ही पड़ेगा, तभी मुझे पता चलेगा कि सब लोग एक्टिव है और सब लोगों को इंटरेस्ट है, क्योंकि आई थिंक वी विल बी हैविंग एन इंटरेक्शन लेक्चर्स। अभी तक तो किसी ने कोई डाउट ही नहीं पूछा। कोई डाउट पूछिए और मुझे पीडीएल विड्थ कमेंट करके बताइए, आपको पता है तो। ठीक है, फिर मैं आपको उसका आंसर बताता हूँ कैसे आंसर देना है। कमेंट करिए गाइस, किसी को तो पता होगा ना। वेरी गुड, गुड आंसर्स, बट एज फार एज आई थिंक उतनी नहीं होती है। ठीक है, 2 to 3 mm, 4 mm, कोई बात नहीं। मुझे जहां तक पता है, मुझे जहां तक पता है, कोई बात नहीं, आप भी सही हो सकते हो, क्योंकि मैं तो वैसे प्रोस्टोडोंटिस्ट हूँ। पेरिडोंटल लिगामेंट की जो विड्थ होती है, मैंने जहां तक पढ़ा था एमडीएस में, वहां पे पॉइंट 1 to 2.35 थी। ठीक है, ये अगर रेंज में पूछा जाए तो, और अगर डायरेक्टली पूछा जाए तो आपको 2-3 लिखना है ऐसा कुछ था। क्योंकि कभी कभार क्या होता है आपको तो पता है, बहुत सारी चीजें रटने पर आती है, यू टू मग इट अप। तो ये मैंने मगअप किया हुआ है, और ये क्वेश्चन शायद बहुत सारे एग्जाम में भी आ चुका है। ठीक है, तो 4 mm जितनी तो पीडीएल की विड्थ नहीं होती, कोई बात नहीं, आंसर किया वो अच्छी बात है। देखो अभी हम गलत होते हैं ना कोई भी क्वेश्चन पर, तो इट्स ए गुड थिंग। ठीक है, मैं भी ये बता रहा हूँ आपको, तो आई मे बी ऑल्सो रॉन्ग। इट इज नॉट दैट आई एम सुपर कॉन्फिडेंट, बट एज फार एज आई नो। तो देखो अभी मैंने जो आपको बताया ना, कि जब भी आप आंसर दे रहे हो तो आपको ये चीज बोलनी है कि एज फार एज माई नॉलेज इज कंसर्न, और एज फार एज टू माई नॉलेज दिस इज द आंसर। ठीक है, the second thing is you have to never stick to your answer. Okay, for example, you are told that it is the range and it is 0.23, but it did not mention base from what source you are telling, from a Keranza, from this any other source, or from online source. So you have to answer these questions. So whenever you answer, you have to always start your base. Okay, first of all you will tell that according to this book, or according to this concept, and as far as my knowledge this is the answer. So why? Because there are many thoughts. Okay, this is the thing, this is the thing. Oh, there are many thoughts. For example, many questions are asked, कैल्शियम हाइड्रोक्साइड जो होता है वो हम लगाते हैं दांत में, तो डेंटिन कैसे बनता है। ठीक है, तो बहुत सारे थॉट्स हैं, तो हमको तो 3-4 थॉट पड़े सब एक्सेप्ट कर लेना है, बट एग्जाम में सारे थॉट्स आपको रिप्रोड्यूस करना है। यू हैव टू मेंशन all the thoughts. First thing is that since calcium is there, it will be directly embedded in the dentin. Second is that calcium का alkaline pH होता है, वो ऐसा एटमोसफियर बनाता है कि डेंटिन को अच्छा लगता है बनने में, डेंटिन ग्रो हो जाता है। तीसरा थॉट ये है कि जो कैल्शियम हाइड्रोक्साइड है, वो कैल्शियम का जो लेवल होता है ब्लड का, ठीक है, वो कम करता है, वो कैल्शियम चला जाएगा डेंटिन में और डेंटिन बन जाता है। तो ये जितने भी थॉट है, जितने भी आंसर है, ठीक है। मुझे कमेंट आ रहा है, सर यू आर वर्किंग एज क्लास 1 डेंटल सर्जन। जी, अब मैं इंट्रोडक्शन देना चाहता हूँ अपना, कोई बात नहीं। आई एम डॉक्टर प्रवीण परमार, working as dental surgeon class 1 in Bota district. I have passed both dental surgeon class 2 and dental surgeon class 1 in the year 2020. 21 passed, in 20 exam was there, in 21 interview was there, and in 22 we got placement. Since many years, I am giving coaching to all the students. It's my website, medicaldentalacademy.com. In this, you will be able to search all the free materials. Test series is there, which is very good. Our many alumni right now passed oral surgery from AIMS College. So many MDS students have been passed under my guidance. So no issues. Introduction is over. Now we move to our conceptual discussion. तो कैल्शियम हाइड्रोक्साइड डेंटिन को कैसे बनाता है, तो ये भी थॉट है। तो जब भी आपको कोई क्वेश्चन पूछे इंटरव्यू में तो आपको खाली ब्लंट आंसर नहीं देने हैं, आपको बहुत सारे अपॉर्चुनिटीज भी सोचना है कि ये है वो है, और जो भी आंसर दे रहे हो ना आपको इलेबोरेटिव आंसर देना है, ठीक है, इलेबोरेट करके आंसर देना है कि सर ये भी हो सकता है, ये भी हो सकता है, ठीक है। तो कभी कभार आपको ये भी आपकी मैच्योरिटी दिखाती है कि दिस गाय इज हैविंग गुड नॉलेज, गुड कंटेंट, ठीक है। और ऐसा भी पूछते हैं कि अगर ये हुआ तो आपको नहीं आता है तो मना कर दो इंटरव्यू में कि सर आई एम सॉरी, आई कुड नॉट रीड दिस फैक्ट और आई एम अनेबल टू आंसर दिस एट प्रेजेंट। तो ब्लफिंग नहीं चलता है, ठीक है, जीपीएससी में। तो हम लोग जो अभी लेक्चर ले रहे हैं, कोई लोग ऐसा बोल रहे हैं कि सर ओरल सर्जरी पढ़ाओ। ओरल सर्जरी तो आप भी पढ़ सकते हो, मैं भी पढ़ा सकता हूँ, कुछ भी कर सकते हो, लेकिन कुछ बेसिक चीजें अभी से आपको माइंड में रखना है। Why I am discussing all these points right now is because when you are preparing anything, you have to think that it is your interview tomorrow. Okay, for example, if you are reading any topic right now on oral surgery, so you think that questions on oral surgery will be asked in tomorrow's interview. So you have to read in that manner that you will be able to answer all these questions. For example, toxicity of LA. So in this time, when any question about toxicity of LA is asked, you will be able to answer all these toxicities, systemic, local, even simple also, needle breakage, etc. So now, if you are not prepared for this by your own, by answering your own in your mind, you will not be able to answer at that time. Some few points will be left, and you will be not able to speak thoroughly. So when you will be not able to speak thoroughly, they will understand that this guy is having some anxiety. When anxiety is there, you will not be able to answer properly. Your interview will be failed. So this is the point where I am discussing. I am already discussing repeatedly same topic, content, concept, and your proper thorough reading. Okay, this is not only related to your prelims, because prelims will be passed by many people. Your final litmus test is interview. In interview, you have to score in that manner that you will be having good comparative score than others. Okay, so now if you are having any doubts, you can please tell me. Hardik is telling that point 15 to point 38. So this is the I'm telling confusion. Okay, in my book it was point 15, point 12 to 35 when I was reading about MCQ. Okay, one good question is there. Do they ask any questions? 1 minute. Do they ask any questions? GK questions in an interview? Yes, of course. Before 1 year for dental GPSC class 2, we had conducted mock interviews. So in that mock interviews, many people got experience. So in interviews, what will be asked and what will not be asked, we'll be discussing in short. Okay. First of all, in interview, you will be given one code. For example, PQR. Okay. Once they give you the code, you will be not telling your name or anything which reveals your identity. Okay. So directly when you go inside the room, enter. So with your courtesy and good manners, you have to ask, may I come in? And then wish them with a good smile. Okay. And when you are wishing, it is not that you have to wish only one, sir, because when they are sitting, all are equal to us. So I personally wished all of them. Okay, this is basic courtesy or somewhat like ethics. Now, after that, you have to just stand near the chair when you are supposed to sit. Okay, you should not be going there and just sitting without asking anything. You will be standing and they will be asking you to sit. Once you sit, okay, हम बैठ गए अभी, तब तक तो समझ में आ गया होगा आपको कि आपको जल्दबाजी नहीं करना है, अंदर जाके सबको देखना है, अच्छी तरह से स्माइल देना है, ठीक है, और विश करना है, पोलाइट रहना है, हैंड्स फोल्ड कर सकते हो आप। और ड्रेस कोड भी कोई सूट पहन के आता है, मैंने तो सूट नहीं पहना था, कोई साड़ी पहन के आते हैं, मतलब इट्स एन थिंग। बट दिनेश दास सर नहीं बोला था कोड, वो जो ड्रेस कोड है कोई है नहीं लेकिन आप जो जहाँ जॉब करने वाले हो, आपकी कोई जो प्रोफेशन है, उसके हिसाब से थोड़ा अच्छा ड्रेस कोड होना चाहिए। ठीक है, अगर डॉक्टर होते हो तो टी शर्ट पहन के नहीं जाना चाहिए, गर्ल्स होते हो तो टॉप पहन के नहीं जाना चाहिए। ऐसे तो आपको मुझे ज्यादा नहीं बोलना चाहिए, कोई बात नहीं। अभी आप बैठ गए, ठीक है, तो आपको तो सीधे भी जो सामने बैठे होंगे ना, वो क्या होता है, राउंड टेबल जैसा होता है। यहाँ पे एक जो मेन सर होते हैं वो होते हैं, और यहाँ पे एक मैडम, दूसरे मैडम, तीसरे मैडम और चौथे मैडम, और आपको ट्राइंगल पर बिठा देते हैं। ठीक है, ट्राइंगल मतलब फॉर एग्जाम्पल, तो यहाँ पर आप बैठ गए तो आपको सीधा आई कांटेक्ट रखना है सर के साथ। ठीक है, क्योंकि ये जो सर है या मैडम है वही आपका इंटरव्यू स्टार्ट करेंगे। ठीक है, तो अभी जैसे ही आप देखोगे उनके सामने, आपको बोलेंगे कि पहला ही क्वेश्चन इंट्रोडक्शन, और कोई सर होते हैं जो आपको थोड़ा રિલેક્સ करना चाहते हैं तो गुजराती में पूछेंगे, કેમ છો દીકરા, શું કરે છે। मुझे तो ऐसे क्वेश्चन पूछे थे कि आप यकीन ही नहीं कर पाओगे। मैंने इंट्रोडक्शन दिया कि आई एम PQR फ्रॉम भावनगर, अभी सूरत रहता हूँ, ठीक है, और ये जॉब कर रहा हूँ अभी। तो भावनगर का नाम आया तो सीधा ही पूछा कि भावनगर का एक जो कહેવत है, मतलब કોઈ કહેવત છે કે બહુ પ્રખ્યાત છે, તો એવું કહેવાય છે કે ભાવનગરના ગાય ગાંડા અને ગાંઠિયા વખણાય છે। તો એ કહેવત મને સરે કહેવાનું કીધું। તો આઈ વોઝ મતલબ ઇન અ ડાયલેમા that whether I should speak or not, and if they will create a joke, I will be directly suspended. So I told sorry to sir, sir, I think it is not wise to tell this answer, but if you still insist, I should tell. But sir, if you please allow me, this is not a answer to tell right now. So I resisted, sir, but sir told that no, no, don't worry, please tell that what is famous. Then sir only started, one thing is guy, then what are the other things famous? Okay, so I told that Ganda and Gatia. Okay, so this was the position, or this was a technique where sir wanted to make me relax. Actually, I was not in tension only, but sir wanted to anything related to Bhavnagar. Okay, now this is the some thing which cannot be anything related to Viva, but I was also surprised that these questions will be asked. Now, after this, second question is, do you think ભાવનગરના લોકો ગાંડા હોય, મતલબ તમને એવું લાગે છે કે ભાવનગરના લોકો ગાંડા હોય? તો I answered, sir, as far as my knowledge, nothing is like that. But still, I am also in a plan to go for research on this question. I should, if I am allowed time, I have to search on this question, that why these people, मतलब गुजराती में मैं कीधु तो गुजराती में ही मैंने बोला था कि मुझे सर મને પણ એવું લાગે છે કે આ લોકો કેમ ગાંડા કહે છે, મારે પણ એકવાર બધાને પૂછવા જવું પડશે, એવું મેં કીધું તો આ લોકોને। કોઈ વાંધો નહીં, પણ એ રૂલ એક છે, જો ગુજરાતીમાં ક્વેશ્ચન પૂછે તો ગુજરાતીમાં આન્સર આપવાનો, હિન્દીમાં પૂછે તો હિન્દીમાં, ઇંગ્લિશમાં પૂછે તો ઇંગ્લિશમાં। તમારે લેંગ્વેજ બેરિયર કરવું હોય, લેંગ્વેજ તમારે સિલેક્ટ ચેન્જ કરવી હોય તો તમારે કેવું પડે, સર ઇફ યુ અલાઉ મી, કેન આઈ સ્પીક ઇન ઇંગ્લિશ, કેન આઈ સ્પીક ઇન ગુજરાતી। ઠીક છે, એ તો કોઈ વાંધો નથી, એ બહુ રિલેક્સથી તમે આન્સર આપી શકો છો। ઓકે, હવે એક ક્વેશ્ચન આવ્યો, પછી ડાયરેક્ટલી દે ઓલવેઝ ધ સેન્ટ્રલ સ્ટાફ, ઓકે, આપણા સ્ક્વેર વાળા સ્ટાફ, આ સ્ટાફ, એ સ્ટાફ તમને જીકેના જ ક્વેશ્ચન પૂછશે, તમારા એરિયાના જ ક્વેશ્ચન પૂછશે, તમારા બેકગ્રાઉન્ડના ક્વેશ્ચન પૂછશે। એટલે જીકેના ક્વેશ્ચન તો આવશે આવશે ને આવશે જ તે। તમે એમ કહેશો કે હું ભાવનગરનો છું તો ભાવનગરનું પૂછશે, તમે એમ કહો કે હું અમદાવાદનો છું તો તરત અમદાવાદનું પૂછશે કે અમદાવાદમાં શું શું વખણાય છે, અમદાવાદનું શું એવું ફેમસ છે કે જે બીજા ક્યાંય નથી, અમદાવાદની યુનેસ્કો હેરિટેજ સાઇટ આપ્યું છે તો કયા એના મતલબ મુદ્દાઓ છે કે જે આપણે નોંધ લેવા જોઈએ। તો એ લોકો આવા ક્વેશ્ચન્સ ગુજરાતીમાં પૂછે છે, અને જો તમે બરાબર આન્સર ન આપો તો તમારું ડાઉનફોલ ત્યાંથી જ શરૂ થઈ જાય, કારણ કે જે સર આ છે સ્ક્વેર વાળા, એ જ માર્ક્સ મૂકે છે, મેઇન સર। બરાબર છે, એ તમારા માર્ક્સ મૂકે છે. એટલે શરૂઆતમાં ઇન્ટ્રોડક્શન, તમારી ગુજરાતીની જે બોલી છે, જે આન્સર આપવાની સ્કિલ છે, એ તમને બરાબર રીતે ફાવવું જોઈએ અને આવડવું જોઈએ. બરાબર છે, તમે ગુજરાતી નથી ફાવતું તો તમે ઇંગ્લિશમાં પણ આન્સર આપી શકો છો એમને પૂછીને. ઓકે, તો હવે રહી વાત જીકેના ક્વેશ્ચન્સ ઘણા આવી શકે. બરાબર છે, મને તો એવું પણ પૂછ્યું હતું, મેં પોતે ઇન્ટરવ્યુમાં એવું કીધું હતું કે સર મારી જે હોબી છે ને એ રીડિંગ છે. હું અત્યારે યુપીએસસી ની તૈયારી કરું છું અને હું સ્ટડી કરું છું. તો મને ક્વેશ્ચન પૂછ્યો હતો કે પોલિટિક્સ શું કહેવાય એમ, બાયોપોલિટિક્સ, જીઓપોલિટિક્સ, બાયો નહીં, સોરી, બરાબર, જીઓપોલિટિક્સ શું કહેવાય? તો એમાં મેં સરસ આન્સર આપ્યો હતો કે અત્યારે ચાઇના જે બેલ્ટ એન્ડ રોડ ઇનિશિયેટિવ ચાલુ કરે છે, બરાબર છે, તો એના ઓપોઝમાં જેટલા પણ કન્ટ્રીઝ છે એ બધા બિલ્ડ બેટર વર્લ્ડ, બરાબર છે, એવી રીતે ઓપોઝ કરે છે. પછી કેટલી જીઓપોલિટિક્સ તો તમે આખું કલાક 2 કલાક હું બોલું તો પણ આન્સર પૂરો ન થાય, પણ મેં શોર્ટમાં એવું કીધું હતું કે આવી રીતે ગોલન હાઇટ્સ છે એ પણ ઇમ્પોર્ટન્ટ છે સર, ઇઝરાયલ ટર્કીના બધું, એ બધું કેટલું મેં આન્સર આપ્યો ત્યારે દિનેશ દાસા સરને લાગ્યું કે આ છોકરો ખાલી ડેન્ટલમાં નથી પણ બીજા પણ જીકેમાં પણ એક્ટિવ છે. તો એ ઇમ્પ્રેશન તમારે પાડવાની છે ઇન્ટરવ્યુમાં. એટલે જ મેં પહેલા તમને કીધું ને કે તમારું કન્ટેન્ટ હોવું જોઈએ, પછી કન્સેપ્ટ. ડેન્ટલનું તો કેવું છે, જે બાકીના સ્ટાફ છે ને એ જ ડેન્ટલના ક્વેશ્ચન પૂછશે. હવે ડેન્ટલના ક્વેશ્ચન પૂછશે, તમે જે આન્સર આપવાની સ્ટાઇલ છે, તમારો કોન્ફિડન્સ છે, તમારું કન્ટેન્ટ છે, તમારી કઈ રીતે આન્સરિંગ જે મુવમેન્ટ છે હાથની કે લિપ્સની કે જે તમે બોલો છો એ તમે કયા મતલબ સ્ટાઇલમાં બોલો છો, તમે પેશન્ટને કઈ રીતે સમજાવી શકશો, એ નોટ કરનાર આ સ્ક્વેરવાળા સર, મેઇન સર. ડેન્ટલના સ્ટાફ હોય ખાલી ક્વેશ્ચન્સ પૂછવા માટે આવે છે, બરાબર છે, તો એ પ્રિપેરેશન આપણે કરવાની હોય છે. હવે આપણી એક જ એકેડમી એવી છે, મતલબ our academy is only academy which will be providing you dental Gpsc prelim coaching as well as mock interview batch. Okay, so when you are having any doubt related to dental Gpsc prelim or preparation or interview, we are the only academy right now, I think, because no one is providing coaching on dental Gpsc. Now regarding time, what is time between coaching this result and interview? So it depends, because in many prelims the time is of 1 year. मैं आपको बता रहा हूँ कि 2020 में एग्जाम दी, 21 में जनवरी में रिजल्ट आया प्रीलिम का, और 6-8 महीने के बाद उन्होंने इंटरव्यू लिया. तो sometimes 3 months will be there, sometimes 8 months will be there, but when seats are very less, for example 20 seat is there, so I know, matlab I am somewhat in dilemma that minimum or maximum of 30 to 40 days will be there between the result and इंटरव्यू. आपको 30 या 40 दिन से ज्यादा नहीं मिलेगा टाइम प्रीलिम और इंटरव्यू के बीच. ओके, और प्रीलिम में क्या होता है, आपको एग्जाम देने के बाद आपको पता चल जाएगा कि आप क्वालिफाई हुए कि नहीं. तो जब होते हैं ना उसके बाद महीने में ही आपको इंटरव्यू का वो कॉल आ जाएगा. लेकिन यू डोंट हैव टू वरी बिकॉज वी विल बी प्रोवाइडिंग मॉक इंटरव्यू प्रैक्टिस ऑल्सो. In the previous year 2021 we have recorded many dental GPSC mock interviews. So we will be also providing you these videos in these lectures only. Okay, तो interview में कुछ भी question, मतलब any questions related to GK will be there, or dental also questions will be asked. For example, if you are preparing for class 2, in class 2 exams any question will be there because many specialty, conservative, ortho, perio, any can come. Okay, for class 1 also the same thing was there for us. One orthodontist were there, one oral surgeon was there, one prosthodontist were there, but there is no limit that they will not ask you any questions from oral pathology, any questions from this, any questions they can ask and check your knowledge. Okay, so these are all the questions related to dental GPSC. If you are having any doubt, you can please tell. We will be starting our oral surgery lecture. Okay, so our oral surgery lecture will be discussing, first of all, see, these notes are very important because when you go for any exam, you have to go with the MCQ pattern first. कैसे MCQ पूछते हैं, ठीक है। फिर you have to go with the previous year papers, that these are the most important questions. ओके, फॉर एग्जांपल ज़ैलोकेन है तो आप कमेंट करके बताइए ज़ैलोकेन का डोज कितना होना चाहिए, मैक्सिमम रिकमेंडेड डोज फॉर ज़ैलोकेन। तो आप कमेंट करके बताइए उसका आंसर क्या आएगा, लिग्नोकेन विथ एड्रेनालिन और लिग्नोकेन विदाउट एड्रेनालिन। डोज भी इंपॉर्टेंट होता है क्योंकि ऐसे ही डायरेक्ट क्वेश्चंस भी आएंगे, इनडायरेक्ट क्वेश्चंस भी आएंगे, because you will be given the weight of the patient, that is for 50 kilo patient xylocan dose will be, so you have to go with the calculation, so you will be knowing the exact dose calculations also, what is that dose. Please comment what will be the dose. किसी को नहीं आता है डोज, ऐसे ही xylocan आप क्लिनिक में दे देते हो किसी को भी, पैरासीटामोल का डोज पूछा होता तो ये दिक्कत है, xylocan का तो आता ही होगा ना आपको। वेरी गुड। 4.4 और 6.6 नहीं था, 7 था मेरी बुक में, कोई बात नहीं, हमारे कंटेंट थोड़े अलग अलग रहेंगे कभी कभार, ठीक है। एक आता है 4.4 मिलीग्राम पर केजी, ठीक है, और दूसरा आता है 7, अकॉर्डिंग टू माय नॉलेज, यू मे बी राइट, बट ये आता है। तो ये 4.4 है, उसको आपको मल्टीप्लाई करना है, ठीक है। तो ऐसे करके किसी ने बोला कि आप एवरेज गिनो, ठीक है, क्या गिनना है एवरेज, कि भाई 70 किलो का आदमी है तो आपको 300 से ज्यादा नहीं देना है और यहाँ पे 500 से ज्यादा नहीं देना है, ऐसे ऐसे भी इक्वेशंस होते हैं। तो ये न्यूमेरिकल वाले जो क्वेश्चंस है वो आपको तो परफेक्ट आने ही चाहिए और ये आपको ऐसे ही याद रखने चाहिए। तो ये मोस्ट इंपॉर्टेंट रिपीटेड क्वेश्चंस बार बार आते हैं, ठीक है। फिर कौन से दूसरे क्वेश्चन आते हैं, मोस्ट पोटेंट टॉपिकल एनेस्थेटिक, मोस्ट पोटेंट जनरल एनेस्थेटिक, मोस्ट पोटेंट लोकल एनेस्थेटिक, ठीक है। तो ये आपको परफेक्ट होना चाहिए, यहाँ पे जनरल पूछा जाए तो भी परफेक्ट होना चाहिए, यहाँ पे टॉपिकल पूछा जाए तो भी आपको परफेक्ट आंसर होना चाहिए। तो ये जितने हैं ना वो तो आपको मार्क्स कटने ही नहीं चाहिए, तो इसके लिए आपको नोट्स बनानी पड़ेगी, ठीक है। ये सब चीजें, अगर आपके पास डेंटोजिस्ट पाटिया की बुक है ना तो वन लाइनर क्वेश्चंस उसमें होंगे, लाइन लास्ट में एमसीक्यू के बाद, तो ये सब वन लाइनर क्वेश्चंस है, ठीक है। आप ये भी बोल सकते हो कि इंपॉर्टेंट फैक्ट्स अबाउट डेंटिस्ट्री, लेकिन ये सब आपको याद रखना पड़ेगा, क्योंकि जो कोई भी पेपर होगा ना 200 या 300 क्वेश्चन का, ठीक है, उसमें आधे क्वेश्चन तो ये बेस वाले ही आएंगे, ठीक है। अभी क्वेश्चन पैटर्न ये है कि 200 एमसीक्यू आएंगे, तो ये लोग क्या करते हैं 100 एमसीक्यू है ना, वो भी मैंने जो बताया ना बेस वाले क्वेश्चंस, विच इज द मोस्ट पोटेंट टॉपिकल एनेस्थेटिक, ऐसे क्वेश्चंस में से आ सकते हैं, ठीक है। विच इज द नर्व ऑफ सेकंड ब्रेंकियल आर्च, ऐसे क्वेश्चंस। तो 100 आपको सिक्योर करना ही पड़ेगा, तभी आपका पहला स्टेप पूरा होगा जीपीएससी में आगे जाने के लिए, ठीक है। अब दूसरा स्टेप जो है ना 50 क्वेश्चंस वाला, वो ऐसा है कि वो ट्विस्ट करके पूछेंगे क्वेश्चन, ठीक है। मैं एक एग्जांपल देता हूँ आपको, क्योंकि मेरे ये एआईपीजी में क्वेश्चन आया था 2010 में, मैंने एआईपीजी जब दी थी तब ये क्वेश्चन आया था, ठीक है। एडीएच है, एंटी डायरेटिक हार्मोन, ठीक है, वो ब्रेन के या कोई न्यूक्लियाई जो होगा वो कब न्यूक्लियाई में दिक्कत होगी तब एडीएच में दिक्कत आएगी। मतलब एडीएच का क्वेश्चन नहीं था, मुझे तो डायबिटीज इंसिपिडस का था कि डायबिटीज इंसिपिडस उसका रिलेशन किस जगह पर दिक्कत आएगी या ट्रॉमा होगा तो डायबिटीज इंसिपिडस होगा। तो अल्टीमेटली ये क्वेश्चन ऐसा था कि डायबिटीज इंसिपिडस है ना, वो एंटी डायरेटिक हार्मोन की डेफिशिएंसी से होता है। और एंटी डायरेटिक हार्मोन जो है ना, वो सुप्रा ऑप्टिक न्यूक्लिया जो होता है ब्रेन का, उसमें से होता है। ठीक है, तो ये क्वेश्चन डायरेक्ट नहीं था, एडीएच कहाँ से रिलीज होता है। ये क्वेश्चन ऐसा था, डायबिटीज इंसिपिडस किस एरिया ऑफ द ब्रेन के साथ कनेक्टेड है। तो ये ट्विस्टेड वाले क्वेश्चंस आएंगे। ठीक है, तो कोई बात नहीं, तो ऐसे क्वेश्चंस 50 आएंगे। ठीक है, तो आपके 150 में से अभी क्या हुआ, अगर आपने पूरा कंटेंट ठीक से किया होगा या पेज पूरा ठीक से पढ़ा होगा तो आपको 100 तो आ ही जाएंगे, वो पक्का है। और ये 50 में से ट्विस्टेड क्वेश्चन में आप गिनो कि 40 आएंगे। ठीक है, अगर सब आपको आ गए तो। और बाकी की जो 50 है ना, वो तो मुझे भी नहीं पता होंगे कहाँ से आते हैं, और उसके आंसर किसी को भी नहीं पता होंगे, क्योंकि वो लोग इंटरनेट से कोई भी क्वेश्चन बना के रख देते हैं। अभी लेटेस्ट कुछ एडवांसमेंट आता है, कोई नया डिवाइस आता है, कोई भी कॉन्फ्रेंस होती है उसमें कुछ नया लॉन्च होता है, बहुत सारी चीजें इसमें आ सकती है। तो इन शॉर्ट जो बाकी के 50 है ना, उसमें से आपको कितने तुक्के लगाने हैं, कितने अटेम्प्ट करने हैं, कितने नहीं करने हैं, वो सब आपको ध्यान से अटेम्प्ट करना है। ठीक है, तो ये पैटर्न हुई 200 एमसीक्यू को कैसे आंसर करें। 300 में भी सेम है, 300 में 150 रिपीटेड आएंगे, कॉमन आएंगे, आपको जो पता होगा वो आएंगे, अगर आपने सारा कोर्स थरली किया है 5 या 6 बार। बाकी जो 50 है क्वेश्चन 150 में से, बाकी के 50 या 70 वो क्वेश्चन ऐसे आएंगे जो आपको थोड़े दिक्कत वाले रहेंगे। क्या दिक्कत वाले रहेंगे कि इसमें क्या लिखूं क्या नहीं। ठीक है, 1 मिनट। थोड़ी दिक्कत आई है, वेट मिनट। तो हम जो बात कर रहे थे वो आपको पहले अंडरस्टैंड करना है पैटर्न की। ठीक है, अब ये अंडरस्टैंड आपको करना है कि अब मैं 200 क्वेश्चंस होते हैं। ठीक है, तो कितने अटेम्प्ट करने हैं कितने नहीं, तो उसका आंसर मैंने बता दिया। उसका आंसर हमारी टेस्ट सीरीज है जो आर्टिफिशियल इंटेलिजेंस से चलती है। आप जैसे ही टेस्ट सीरीज आंसर वो करोगे, ठीक है, तो मैं आपको भी रिजल्ट भी बता रहा हूँ कैसा वो आएगा। वेट अ मिनट।